I'm going to Drury University. I drive back and forth to Springfield every day. Yay, great fun that is. I went back to school to be a music therapist. I encountered music therapy in some of my dealings, and it was super helpful to me in healing, and I decided that I wanted to become a music therapist with that. And so I am in my last year of school, yay, and so I needed to, one of my classes was to come and do an advocacy for someone, and I decided that what better place to do advocacy than Ozark Center, where hopefully after I graduate I can come and possibly do work for. So luckily I knew someone and he was able to get me in. So we're going to talk a little bit about music therapy today. Yeah, that was my mouse. Yay. So like I said, I'll do the slides up here a bit, how much you can see of it, because it's a little ways away from you. So, okay, we'll start off with what is music therapy. So I don't know how much you guys know about it. Probably a little bit, being therapists, you may have heard some of it. It's a clinical and evidence-based use of music interventions to accomplish a therapeutic relationship. Basically, all those big words mean we go in and play music to accomplish therapeutic goals. So like what you would do with your talk therapy, we do through music, basically. So that's the laid out version of, hey, this is what we do. It does have to be done by a licensed professional. So in the end, we get a license, and we'll talk about that in a little bit. It's not just going in and playing songs. That's not music therapy. That's nice and a good thing to do, but that's not music therapy. So we'll get into that too, but that is the main thing. We can assist clients anywhere from little children, even NICU babies, we'll talk about that, all the way up to older adults and dementia, Alzheimer, even just end-of-life care. So it's a wide varying range. Several different areas that you can go into and help. So huge range of people. We address all kinds of different needs as well. Physical needs, cognitive needs, emotional needs, and social needs. So it's not just like disability. There's obviously disability through every stage of life, but it's not just that we help. Help physical needs, like in pain, also emotional needs, as in like what most of you deal with on a daily basis. Social needs, as far as like getting back in with society, help people for that, so that they're not just isolating. Cognitive needs, people that have lost my train of thought. Like any kind of issues with, I would say like schizophrenic is what comes to mind, especially with cognitive thinking, those kind of needs. So any kind of needs that you can think of. People that can administer music therapy, we'll talk about that for a minute here. Like I said, you do have to have a degree. It's not just going in and playing songs. There is quite a stringent task to get a degree. It's not simple, as I found out. You have to have a bachelor's degree or higher. There are master's degrees that you can get. I am not opting to get a master's degree at my age. However, if a younger person were to go into the field of music therapy, they may want to get a master's degree. You can also get a PhD. I believe my teacher one of my teachers has a PhD in music therapy. You have to have, there are 72, which is not a lot, but there are 72 accredited schools in the nation that you can get a degree in music therapy in. You have to have 1,200 clinical hours before you can be certified, and you do have to pass a board exam. I'm not looking forward to taking that, but you do have to pass the board exam. So, and then you get letters after your name. Exciting, right? Yay! I get to have letters. So I've never had letters before, but and there's then like on your paper, there's a little symbol, the American Music Therapy Association, and that's who we get accredited through. And you do have to recertify every 5 years. So you don't just like get it and you're like, whew, I'm done, I don't have to do anything else now, I can just do this for the rest of my life. No, that's an ongoing process, so you do have to recertify every 5 years. So that way you know you're getting someone that's legit, that can actually do this, and then they have to recertify, so they have to keep up on things. And it's not just oh, we did it, and now we can just go sing songs with people. So it's a pretty stringent thing. To get a music therapy degree, you have to have knowledge in not only music, also psychology. I've been through several psychology classes. Find it kind of interesting and fun, because some of the stuff that I've learned in there, I was like, well, that's very interesting, knowing what I know now and just putting some of it together. And then also, we had to have some classes in medicine. Excuse me. So we'll have a little bit of medical knowledge and some psychology knowledge, and of course music knowledge. Excuse me. Knowledge in music obviously being the biggest, but you know, having to have some of those other knowledge as well. Where do we work? There are several places listed. Oh, I'm sorry. First, I want to talk about who can benefit. I'm sorry, I skipped a slide. People that can benefit from music therapy, like we talked earlier, birth to old people. And the older adult people can be anyone like mental health issues, Alzheimer issues, end-of-life care. Children can be people that are like autism issues, or just like ADD issues. People with brain injuries, people with physical injuries. This one is interesting to me, mothers in labor. That may sound like, why would we need to help people in labor? But it's a pain issue, and music therapists help people in pain. It reduces the effect of pain, and so a music therapist can help in that and aid in pain. So that sounds like a strange one, so I thought that we would touch that one in a minute, because that's what we're there for. We aid in reduction of pain. So that's one you might not think about. But so there's several different things that music therapists can help with. Now we'll talk about where we work. And again, several different places that we can work. And this is probably not all of them. This is a lot of places, but maybe not all of them. Psychiatric hospitals, medical hospitals. I have a teacher that she used to work in a medical hospital, and she would have a pager, and they would call her and be like, we need you to go to room whatever, and this patient's requesting music therapy. And so you would go to that room and you would do that music therapy for like a half hour with that patient. And this is something that I would love for us in this area to be able to do. But she works with NICU patients, and so you can work and then in drug and alcohol facilities. That would be awesome. You know, here to have something like that. To work in correctional facilities, nursing homes, an obvious one, to work with the elderly. And then, let's see, what's another one? Private practices. You know, if you had a doctor's office and you did some music therapy with doctor's offices, they could do like go to your doctor and then they could prescribe a certain amount. Also, they work in private homes with people that are maybe end of life care or something, and they do just like your physical therapist or your OT or something. You know, you have a music therapist that's on call, and they go and do private home care. So there's several different places. I didn't touch all of them, but you can read. So we don't really need to read for you. And then who music therapists work with. And we've touched on this some too. So, but you know, this like kind of gives you what the care is that it helps with. Like people with Parkinson's, it helps to improve motor function. So that's a big thing. You know, is it going to cure the patient? No, but it's going to help them with some of the things that they're having trouble with. Adults with mental health issues, it's going to improve their global state, improve their symptoms, and help with their functioning. Adults with dementia, it's going to lessen the effects of dementia. Premature infants, it's going to improve their sleep patterns and increase their weight gain because it calms them down. When you calm the infant down, obviously it's going to help them sleep. If they're sleeping, weight gain. It's all a cause and effect. So that's what music therapists do, and that's how they help in that way. All right, let's talk about some of the treatments. Oh, I threw my back over me. Oh no! Sorry, guys. There we go. Okay, we do treatment through several different ways. We do creating things, we do movement, listening, and singing. Movement, and I put some scarves on there. That's a simple thing that they can do with, again, little kids, and then maybe older adults. You probably wouldn't use scarves with like adolescents or even people like my age. That's probably not something you would do, but older adults or little kids. Singing, of course, that's any age related. And listening to music, that's any age. And creating, maybe like songwriting or something like that, that can be any age. And then let's talk about some of the types of interventions that there are. We do things called drum circle. There's a picture of that on there. Drum circle is fun for any age. That kind of lets out people's frustrations, and it's pretty fun. And anyone can do that kind of a thing. You're just beating on a drum. Of course, there's a pattern to it and a rhythm and a manner of doing it. Songwriting is something that you can do. Rock band, there's a picture of that on there. Even if you don't know how to play an instrument, that's something that anyone can do. It's real easy. Structure. I was in a group that I did a practicum in, and we did a rock band, and the kids loved it. And these were adolescent kids that were in substance abuse issues that I worked with, and they loved it. They didn't know how to play instruments, but by the time it was done, they had written a song, played the instruments, and recorded the song, and they got to take that song with them, and that was something that they loved to do. So that's something that anyone can do. Lyric analysis, we took a song and we talked about the lyrics and what they meant and how that affected them, and it was a great like deep thinking exercise for these kids, and they loved that. Movement, again, talk about like the scarves and things, and that's good for older adults. It gives them exercise, and they're still talking about singing, and they love that. And then just instrumental involvement, which we kind of talked about already. Music therapy is a way of communication for those who find it difficult to express themselves in words. Music is one of the only activities that stimulates, activates, and uses the entire brain. So you're not only using pieces of your brain, like your frontal lobe or your parental lobe, you're using every single piece of your brain when you use music. So that's why it's so good for people with like brain injuries and things like that, because you get to use your entire brain. And then I kind of focused on mental health in this slide, just because I knew that's where I was coming, so I thought I would talk about it for just a minute. And if you guys want to read through those slides, music therapy allows people with mental health to do several different things that maybe it wouldn't for another aspect. It explores personal feelings. It helps you practice problem solving with some of the interventions and things that we do. It can make positive changes in your emotional state, resolve conflicts, which leads to stronger family and peer relationships, which we're always searching for with that mental health. It makes positive changes in your mood, which I know that's one thing that we're always trying to do is improve mood. And it helps you explore your personal feelings, which we're always trying to do in mental health too, so that you can move on and get better. So music is a great help in that. just a couple more. We're all musical beings and we can heal through music. I put this on the slide that music is a natural drug, and it is, because it gives you a high or kind of a euphoria feeling. Sometimes when you get that great song, you know, you listen to it and you're going, oh, it's such a great song, and you always feel better for that little bit at least. And that's what music does for you. Clients' abilities are strengthened and transferred to other areas of their lives through music. And then just kind of want to sum it up with this last slide, because it just says, when words fail, music speaks. So, it just kind of sums up music therapy for me. I love music, and so when you can't speak, you can always sing, so, or listen to music. So, do you guys have any questions about music therapy?
Do you use it with the people that's been in domestic violence?
You can, yeah.
I think that would be it.
Yeah, sure, definitely.
Do you have a specific population that you're hoping to work with?
I am actually hoping to work with the age range of like 20s to 40s in mental health.
Okay.
Yeah, I am. Yep.
Do you have a specific technique or intervention that you like to do most?
I really like lyric analysis a lot. It's one of my favorites, and I really like doing drum circles. They're super fun. So, yeah.
I have a question you might not know.
That's okay.
So all these different environments that you work in, what is it, like, how do they get paid? Is it something that Medicaid reimburses? Is it something that...
That is a good question. It depends on the state. Some states are reimbursing at this point, and some are not. We have licensure in some states, and some states we don't. Missouri is a non-licensure state right now. We are working hard to get licensure in Missouri. And Medicaid, I think, reimburses in Missouri at this point, but like it's considered not billable for certain places. So yeah, it's a tough one. But insurance is not really considering it at this point. So yeah, kind of crummy.
What do you think the most challenging thing in music therapy will be for you?
At this point, it's going to be the fact that I'm going to have to advocate and try to make a job for myself. That's going to be the hardest thing. So yeah, I'm hoping, I'm going to have to do things like this, and I'm hoping that in this area that people are going to see this as a need and want to do it and let me get my foot in the door. It's going to be the hardest thing, probably. Any other questions? No? Okay. Well, thank you guys for your time and for letting me come today. If you think of other questions, Josh knows how to get a hold of me. So.
Thank you.